and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Eranda Wickramasinghe is the ambassador and volunteer for the Public Health Collaboration, a charity in the United Kingdom in the town of Harpenden. Eranda is a passionate patient advocate for anyone suffering type 2 diabetes, prediabetes, or obesity, chronic diseases that he believes are possible to reverse. Through simple and manageable lifestyle changes, Eranda helps people feel healthier and happier and live a life of abundance. It all starts with hope, the simple idea that things can get better and there is a realistic way to feel happier and healthier. He believes that hope, combined with support, opens up a world of possibilities, and that it doesn't take superhuman effort or willpower, just the willingness to take small steps to make lifestyle changes. Eranda is also the proud father of a wonderful little boy and considers himself the luckiest husband in the world with the most brilliant, beautiful, and supportive wife he could hope for. He is grateful every day for how positive changes has transformed his life for the better. Eranda, it is an honor and pleasure to welcome you to Boundless Body Radio.
Hi, Casey. Likewise, I'm really honored to be here, and I'm a huge fan of your show because so many of my heroes are on your show. I love the Tim Noakes episode. I love the Amy Berger episode. The Dr. Andrew Aswari episode was pretty amazing as well. So many people that I really admire and look up to have been on your show.
Wow, thank you so much. This has been such a meaningful journey, and I have to pinch myself all the time that I get to talk with you guys. It's like you said, all of you are my heroes, and I learn from all of you, and to be able to have these conversations and create these wonderful stories, it's just been really amazing. I gotta say, though, that was the hardest intro I've ever had to read. Did I pronounce your last name right?
Oh, yes, absolutely. So it comes with the territory. I'm Sri Lankan by birth, so we've all got these kind of long surnames.
Well, that's amazing. You better ship me out a trophy or something for saying that. That a dopey white American dude trying to pronounce that. That's a huge accomplishment. I am really curious to hear about what Sri Lanka is like. Obviously, a part of the world I've never been to. What was it like there?
It's a beautiful country. So I'm obviously really biased, but I would say if you get a chance, please go there. And you can have a lot of different types of experience there. Like the local food is amazing. People are friendly. You can see amazing wildlife. So you can do kind of safari kind of trips. There's some beautiful beaches. There's mountain areas that it's a beautiful country. A lot of people go there on honeymoon, actually. Yeah, I went there on honeymoon myself. So,
wow.
Yeah.
Wow, that's awesome. Yeah, I was just looking at some pictures. You're right. Totally beautiful. Just off the coast of India. Is cricket a big thing there?
Huge. I mean, people are just like people are kind of, I don't know, crazy about baseball in the US or kind of American football in the US. People are absolutely crazy about cricket in Sri Lanka.
Wow. I watched a Netflix series that was all about cricket. It kept popping up in my recommended shows because I like sports shows, and it kept popping up, and I was finally like, okay, fine, I'll watch this. It's about cricket. Let's check this out. By 5 minutes into the first episode, I was totally hooked, and I have my Mumbai Indians jersey that I wear all the time that I really love. What an interesting and fun sport to be a part of. So cool.
Awesome. Yeah.
Yeah. So tell us a little bit about yourself. When did you decide to leave Sri Lanka? And what did you decide to pursue?
So I left Sri Lanka in 1990. Because my parents decided to emigrate to the UK. So that's where I live now. And I was 13 at the time. So I think partly at the time, Sri Lanka was going through some difficult times in terms of there was a civil war. There were some terrorist troubles and things like that. Fortunately, those are behind us now, and it's kind of been peacetime for quite a while. We moved to Wales, which is kind of part of the UK. And then since then, I kind of went to university, did all the normal sorts of things. I work in finance professionally. And so in terms of lifestyle change and kind of health coaching, all of that is fairly new to me. So I got diagnosed pre-diabetic, and I was also obese. It was Friday, the 23rd of August, 2019. So it's kind of one of those kind of key life kind of changing moments when you get a diagnosis like that. So yeah, we can go into a little bit of detail around that, but yeah, so that really was the start of, I guess, the fastest period of personal growth I've experienced since I was a child, I would say.
Yeah, wow. Well, we are definitely going to take a deep dive into some of those details. It's such an interesting story, and you've done such an amazing job communicating that. It's interesting too at the time because you were running quite a bit, right? You've completed several marathons, correct?
Yeah. So I began running. I did my first marathon in, I think, 2002. So that was the London Marathon. I finished that in 3 hours and 33 minutes. So not too bad, not too bad. And
That's
then
great.
altogether, I've run 13 marathons, I think, and a
Wow.
lot of half marathons, 10Ks, and things like that. Um, so I certainly did the move more part of kind of maintaining weight. And even when I was running, say, kind of 35, 40 miles a week, I was finding I wasn't really losing weight, or sometimes I was even gaining weight. And so that's kind of when I first started experimenting with kind of the failed paradigm, which is calories in, calories out.
Sure. Do you still have any like special marathon moments, like anything that comes to mind that was like a really, special and interesting moment?
Um, I think yes, because during one of my marathons, my girlfriend at the time, who I'm not now married to, my wife Ruth, so I managed to pick her out. The London Marathon's a huge event. That's kind of literally hundreds of thousands of people. And we'd prearranged that she'd be around a particular point, and like I managed to pick her out in the crowd. And it was such an amazing feeling to see kind of the woman that I loved in the crowd. So I was really happy, big smile on her face. I got back and I got into trouble because she'd gone to all the trouble of making a banner. I was so busy looking at her face, I completely missed the banner. So because I didn't see the banner, she got upset with me. But anyway,
That's funny. I like that. So yeah. So let's go back to the kind of health journey. Like you are moving all the time. You are taking the standard advice and moving all the time. And you mentioned weight loss specifically. So were you considered overweight? Were you obese at all, or like where did you fall on that scale?
so I'd say I was overweight. So I had periods when I was overweight, and then I'd kind of do calorie restriction, usually with food that I hated, or actually things that weren't technically food. They were kind of meal replacement shakes. So kind of, severe calorie restriction for short periods of time, really kind of fighting through that hunger, successfully losing weight. But then I got to the point every time where the hunger just won. I couldn't eat salad and kind of dry chicken breast all the time, so yeah.
Wow. So how surprising was that to you? Because that is such pervasive and standard advice that you just need to exercise more and eat less. Why were you confused that it wasn't working?
I was really confused because all around me, especially in the running club I was a member of, which was at the time kind of Wimbledon Windmilers, place in kind of south West London. All around me, I could see people who were fit and slim and healthy and happy, who just made it look easy. They seemed to be eating the similar sorts of food that I was eating. So I was kind of thinking, what's wrong with me? Am I really greedy? Am I kind of morally kind of deficient in some way, or kind of what's wrong with me, basically? So that I had those kind of thoughts. And whenever there was some breakthrough kind of advertised, like, I don't know, bariatric surgery, or kind of leptin was a big thing once when that was kind of discovered, leptin. And whenever something like that came out, I kind of briefly got interested, but fortunately, I didn't really give those any serious thought.
Yeah, good. Wow. No, it's so interesting. Like so many people that I work with, they like on your initial consultation, they think that they're broken. They think there's something wrong with them. They think they're deficient, and they can't figure out why. And it's like, well, all of us are feeling the same way. There must be something else going on, because we can't all be broken in a certain way. So I wonder if you notice that with the people you kind of work with now.
Absolutely. Sort of, there's so much blame associated with type 2 diabetes and pre-diabetes and obesity. Just people think, oh, I've done something wrong. There's so much guilt and kind of blame and self-recrimination, and it's really sad to see, because really they've done nothing wrong. It's the standard advice and the food environment that's wrong.
Yeah, that's right. So let's go back to your diagnosis. So this was 2019. Was anything like causing an issue at the time, or was this like completely blindsiding you?
So that's an interesting question. So somebody very close to me in the family got diagnosed pre-diabetic a couple of months before that. So I'd already kind of had in the back of my mind that, okay, so I'm in one of my kind of heavier cycles. So I already had it in the back of my mind that, I could be pre-diabetic as well. And I did know a little bit about type 2 diabetes already, because I knew that it's a very serious condition. It increases your risk of cancer, increases your risk of, retinopathy, and you could go blind. You could lose feeling in your feet, and, you could injure your feet, and then you could get these persistent sores that don't heal, and you could end up getting gangrene and having amputations. You could get kidney failure. So my understanding of diabetes was that it effectively, things can go wrong with every single part of your body, including your brain, because Alzheimer's risk is much, much higher in type 2 diabetic. So I was aware that somebody very close to me was diagnosed pre-diabetic, and I had that in the back of my mind. So when I was diagnosed, I wouldn't say I was surprised, but it still was a body blow.
Were you terrified?
Well, yes, partly because the nurse sat me down and said, you're pre-diabetic and you're this. Here's a sheet of paper. Lose some weight and keep it off. So off you go. So that was the level of support I got from sort of the GP practice, because there wasn't any specific advice. But, I knew already that I've been trying to maintain weight my entire life and failing. So I was really stuck in terms of, well, what do I do? Because I know I can lose weight in the short term, but I've never been able to keep the weight off. So what do I do? So I the first thing I did was go back to what I knew already, which was to do calorie restriction. But I did something by accident that was really useful, because I thought, okay, so if I'm going to be eating very little food, I want to at least go to bed on a full belly. So I just didn't eat any breakfast or lunch, and I started just eating dinner, just so I was so kind of paranoid and afraid I wouldn't be able to sleep. And it turns out that's something called time-restricted eating, which is quite useful. So I kind of quite early on, I discovered people like Dr. Jason Fung, Megan Ramos of, the fasting method. And then relatively early on also, I heard a podcast with Dr. David Unwin and also Dr. Jen Unwin, his wife. Dr. David Unwin, he's a primary care physician or a GP in the UK, and his wife, Jen Unwin, is a clinical psychologist. And something that really resonated with me was that it's just their message of hope, saying that, all you need to do is these small changes. There's hundreds of people, if not thousands of people, that find these changes sustainable, and everything will just get better. You'll lose weight, your hunger is going to go away, You'll be able to reverse your pre-diabetes or type 2 diabetes, and you'll feel better than you ever felt before, and all of these things. So, and to be honest, it all sounded too good to be true. So when you're at the beginning, there's so much conflicting information, but I knew from experience that the calorie cutting didn't really work for me. So I thought, what have I got to lose? And they sound reasonable. And I could have read The Obesity Code by Dr. Jason Fung. Looked into some of the scientific references in that book as well. But the main thing for me was, let's take the plunge, and what have I got to lose? And it was astonishing, absolutely astonishing what happened, because I dropped all of my excess weight within 10 weeks.
Wow.
And for me, it was only about, for me, it's a lot of weight. For a lot of people, it won't be a lot of weight, but I lost about 44 pounds of weight in about 10 weeks.
Wow, that's amazing. We will definitely link to the pictures, which is just an amazing tweet that you did to show your progress. How frequently were those pictures taken, and when did you decide that you wanted to document this journey?
So I kind of wanted to keep myself accountable. So my wife sort of helped me out, and once a week, so I'd go downstairs and stand in a particular place, and she'd take a photo. One from the front, one from the side, because I just wanted to see the progress. And initially, I wasn't really expecting anything. Certainly wasn't expecting the kind of progress I actually made.
Wow, that's so cool. So you stumbled accidentally upon OMAD, intermittent fasting, time restricted eating, whatever you want to call it, and then you learned afterwards. That's really so cool. I'm curious to know, how did the actual foods that you chose change over time? Did you eat different things, or did you simply not eat for a better part of the day?
So I did eat different things, but I ate the typical kind of diet mentality type of food, which I used to eat when I was in one of my weight loss phases. So typically things like, tuna with some kind of steamed vegetables, green vegetables, sort of chicken breast without the skin, of course, to cut down on the fat, then kind of boiled eggs. So really kind of joyless food, really. And I didn't enjoy it, but it was working, as it always did in the past. It was working because I was cutting the calories, but I really didn't enjoy the food initially. So it was a real kind of liberation to read the things that Dr. Jason Fung and Megan Ramos were kind of sort of talking about or writing about, and to listen to Dr. Dave Dunneman and Jen Dunneman, because they were saying all these amazing foods are on the table again.
So what were some of those foods? What were some of the foods initially that you decided to change and bring into the diet that you really loved?
Steak. Wow.
Good answer.
Steak, bacon, double cream, butter, cheese, nuts. All these kind of delicious foods, because if somebody said to me, all you're going to have for the rest of your life is steak, eggs, and some green veg, I'd be very happy, because it's delicious food.
Yeah, absolutely. I was just talking to somebody on a coaching call just now. Like, I have maybe 3 or 4 different foods that I ever eat, and I don't want anything different. It looks so restrictive from the outside. Like, oh, you're going to get an eating disorder. You're not eating very many foods. You need to eat more. And it's like, I don't want to eat any more than these 3 things that are absolutely delicious and amazing.
Mm-hmm.
Yeah. Wow. That's awesome. How did the people around you start to respond? And did they also want to kind of jump on board?
That's a really interesting question. So I'd say a lot of people were skeptical because people close to me, they'd seen me kind of really take the bull by the horns in the past, in terms of okay, this is what I'm doing now to lose weight. This is what I'm doing now to lose weight. So they'd all seen me losing a substantial amount of weight before. So it wasn't really anything new. As far as they were concerned, it was just the latest fad thing. And, all likelihood, they thought I'd piled the weight on again. So I think it's really taken people quite a bit of time to get used to the idea that this is not a fad. This is my life now.
Gotcha. And it's always interesting too to hear the story. Most people they're seeking a goal of weight loss, fat loss, something along those lines, but they also notice surprising other things along the way. Did you experience any other improvements on things that you weren't expecting?
Absolutely. Yeah. The main thing is hunger. The main thing is hunger and also mental clarity, because it was really, really strange to me that my hunger, which used to be, I think Eve Mayer describes it as the hunger bully. It used to be kind of like somebody shouting, somebody kind of bullying me and saying, you have to eat, you must eat. So I used to get that kind of almost shaking with hunger kind of feeling. Whereas when I switched to low carb and intermittent fasting, once my body had gone through some adaptation, I was finding that I had the regular kind of ghrelin cycle during the day, but when the hunger came, I could just kind of carry on. I could still focus. And the mental clarity thing, that's pretty awesome, because I did some extended fasts. So in the first 10 to 12 weeks, I did quite a few extended fasts, and I just felt so much at peace. I mean, when you're in deep ketosis, it's a difficult feeling to describe, because it almost seems impossible. Because, for example, 3 days into a fast, I'd be feeling full of energy and I could think clearly. I could do my job. I could go for a walk and do all of the things I normally did, and I could do them better.
Wow. I want to unpack both of those things. You were recently featured on the Big Middle podcast with one of my really good friends, Susan Flory. I love her and I love her work. For the listener, go check out her podcast, The Big Middle. They tackle some great issues and have really great guests, including yourself. You gave one of the best analogies I've ever heard about hunger changing, how the hunger changed for you and how you looked at it. Can you share that analogy that you shared with her?
Yeah, and big thank you to her, by the way. I mean, Susan, she's amazing, and big thank you to her. And so the analogy I used was, so now hunger is sort of, it used to be like a bully, but now it's like a really good friend who comes and taps me on the shoulder and says, "Are you free? Are you free to have lunch? If you're busy, we can kind of reschedule, come back later." And that's what hunger is like for me now, because if I'm busy, I can say to my hunger, "No, thank you," and I'll carry on. I've got a busy work day. I've got deadlines, so I'm just going to work through lunch. I'm not going to have lunch, and then sometimes I do extended fasts, and then sort of when I am ready, when I choose to, I can break my fast, and sort of. My hunger and I, we've made peace with each other. It's like having a really good kind of catch up with a good friend.
Yeah, I absolutely love that analogy. That's probably the best way I've ever heard it put. And then the mental clarity. I don't think people understand what it's like not to feel hungry. And I don't think people understand what it's like to have mental clarity, to not get foggy, to not have their face hit their desk at 3 p.m. What kinds of things, what kinds of practical things did you appreciate more once you had that mental clarity?
To my shame, I've recognized that my behavior before I changed lifestyle, there was almost kind of like a Jekyll and Hyde kind of thing going on, because sort of, for example, coming back from work, I'd be so hungry getting through the door that I was really agitated before we had dinner. So my wife saw a different person before the meal to after the meal, if that makes sense.
That makes perfect sense.
Yeah. So I was this kind of really agitated, hangry kind of person before a meal because I was eating all the kind of ultra processed foods and refined carbohydrates. I was on the kind of the blood sugar roller coaster, and I recognize now that I must have had something like a mild form of reactive hypoglycemia, where my blood sugar would have shot up because of all of the refined carbohydrates I was eating. Then my insulin overcorrects and the blood sugar drops a little bit below to what my brain was comfortable with. And then, alarm bells start to go off, and then the hunger bully comes out and says, you have to eat. It doesn't matter what, you just have to eat right now or something bad's going to happen. So I recognize now that hunger and what I was eating really was affecting my mood and actually affecting how I interacted with people I care about. And also affecting how I interact with people in my professional life, because the mental focus would come in and out. So I had these short periods close to meals when I could think clearly and focus on my work, and then I'd had that kind of feeling of I have to eat something.
I just think if you ask somebody why they're trying to improve their life, if you ask them why enough times, eventually they'll get to something like, I want to be there for my wife. I want to live for my grandkids. I want to have energy to play with my kids. What does it mean? What does it mean to you to know that you are creating more meaningful interactions with the people that you love, and you're creating more time? There's more time for you to be able to spend with them, and it's not even the quantity of time, it's a quality. It's a much higher quality of time that you get with them. What does that mean to you?
Well, for me, I get to enjoy being a dad 100%, as opposed to sort of being distracted and thinking about my next meal. I can be with my boy. And I can be with him 100% and be present and be in the moment. And in the same way, I get so much more enjoyment of being a husband, more enjoyment out of being a brother or a friend, because I'm focusing on the person in front of me, as opposed to thinking about my next meal.
Wow. I just think that's so powerful. I think it's such an amazing thing to experience, and to be able to show up and be present with those people that you love every single day. You talk a lot about having a specific pace, making sure that you're not doing things all at once, but having a plan that's a little bit more sustainable. Can you talk about some of the steps that you took that were able to help you do this in a very sustainable way?
Yeah. So actually, I made quite a few mistakes, as I kind of alluded to earlier. So I kind of started out with the calorie restriction, and then sort of looking back, I think I would do certain things differently, because I'd say I was kind of panicking or really desperate, because I'd read this study by a professor called Roy Taylor of Newcastle University, and they had this crazy kind of schedule of putting their patients on something like 800 calories a day for 10 to 12 weeks. So like a very low calorie diet. And they found that the patients that did the best or got the best results in terms of remission were patients that lost about 10% of their body weight. So I was absolutely desperate to lose weight and lose weight quickly. So when I discovered intermittent fasting and low carb, I started eating more when I was eating, but I did kind of run before I could walk with regards to the fasting. So, for example, I think I did my first extended fast within a week of my diagnosis. So, which was way too soon, because I hadn't really gone through the healthy adaptation, which anybody I talk to now, I say to them, focus on having really good quality, nutrient dense meals, breakfast, lunch, and dinner until your hunger goes away, and you start intermittent fasting almost because you don't feel like eating, because you're feeling so satiated that you don't feel hungry. So it's kind of, I force myself to fast as opposed to being ready for it. So I think a lot of my learning in terms of sustainability came towards the end of that period and afterwards, in terms of, learning that it's sort of, learning the food, to cook food that I really enjoyed, and learning that it's actually okay not to fast all the time.
Yeah.
Because it was kind of a really weird feeling when I lost all the weight. It's like, oh, what do I do now? Do I eat one meal a day? Do I eat 2 meals a day? What do I eat? How often do I fast? All those kinds of questions. So, and it's been a huge learning process.
Yeah, sure. No, that's a really good point. I kind of tell my people, like, look, you really better get more fat adapted, eat those healthier, more nutrient dense foods, get a little bit more fat in your diet. And you're right. It's almost like a natural thing. You're not on some schedule. You're not, have to do fasting for X amount of hours. You're just not really that hungry. And then it opens up so much time freedom where you can go out and do other things. You're not thinking about food, like you said. Like, you can be more productive at work, or you can go on a walk, or you can go play with your kids. There's all these other things that you can do besides eat all the time. I notice it on vacations too. Like, when I go on vacation, the time that it used to take me to go to breakfast, and then you need to make sure you're near some place that has a snack, and like all that stuff goes out the window. Now all this time you get to just go explore and have fun. It's great.
Yeah, absolutely. I mean, and mornings are so great that way because, like you said, if you're not worried about breakfast, you can go for a run, do a workout, play with my son, take the dog for a walk. There's any number of things to do.
Yeah, it's just so enjoyable. You've already mentioned your relationship with the Unwins. We were so fortunate to be able to talk to both David and Jen Unwin at the same time, which was, incredible. Absolutely incredible. Can you tell us a little bit about your special relationship with them and how they've helped along the way?
Yeah, so very early on, August 2019, September 2019 was the first time I really came across Dr. David Unwin and Jen Unwin, and I remember watching a YouTube video of them, kind of doing a role play of doctor and patient. So in terms of, I think Dr. Jen Unwin was pretending to be a type 2 diabetic, and Dr. David Unwin was being the doctor, and he was kind of comparing and contrasting his old style in terms of scaring people to death with everything, all the horrible things that could go wrong with type 2 diabetes complications, and then kind of contrasting that with a method that really Dr. Jen Unwin kind of perfected, sort of called the Grin method. So, which is all based around hope, which is all based around kind of, if you were able to reverse your or kind of get into remission for your type 2 diabetes, if you were successfully able to lose the weight and keep it off, what would that mean for you in terms of your life? Would it be more time with your kids, or kind of more time playing with your grandkids? Would it mean kind of you get more out of life in terms of a lot of activities that you'd wanted to do before, but you didn't really have the energy to do? Would it mean, wearing clothes that you preferred, and so many other things? So I think I really responded to that, and I've been following them ever since. And that's the first time I came across the non-profit, the charity that's called the Public Health Collaboration. So that was founded by Dr. David Unwin and Jen Unwin are kind of an integral part of the charity, and also the founder and director Sam Feltham, who's a kind of amazing person. And it really inspired me after I recovered to volunteer and say, sign me up. How can I help? And since then, for the past year, I've been running a type 2 diabetes, pre-diabetes and obesity remission group. So typically once a week, an hour and a half Zoom call on a Thursday night. And, since I've been running that group, 2 people in the group have achieved type 2 diabetes remission, which is pretty amazing. It's a group of 6. The others aren't type 2 diabetic. They've got kind of obesity. And, a lot of the other members, they've kind of lost weight as well and been able to keep it off. And recently, we've started a new initiative with the charity called the Lifestyle Club. So that's I'm working directly with primary care doctors now. So that's 4 of us, 4 health coaches, trained up by Expert Health. Trudy Deakin kind of ran the course, and then I've been looking after looking after 16 patients myself, but I think between the 4 of us, we've been looking after nearly 100 patients spread across different GP practices. So a big shout out to my kind of fellow health coaches. So Heather Temple Marsh, Helen Gowers and John Furness. So it's a pilot scheme and it's a 12-week scheme that kind of finishes in September. And, fingers crossed, we'll be able to demonstrate that of the 100 or so patients that are under our care, that we've been able to get them some really good results, and hopefully a few of them by September will be in drug-free remission, hopefully.
That's incredible. Why? Why are you doing this? You have a day job, you have a family. Why would you take time out of your life to go volunteer for this charity?
That's a really good question. So I think it's 2 things. First of all, now that I've recovered, I found this enormous capacity that I didn't have before. Capacity in terms of, mental clarity, sort of endurance, energy. So I've got the capacity to do more now and to get more out of life. And then also, I remember what it felt like not having the first clue about what to do, where to even start. And I remember what it felt like going to my local GP practice and being told, oh, here's a piece of paper, lose some weight, keep it off, come back and see us. So I got 0 support. So I remember what that felt like. And when Sam Feltham said that here's an opportunity for us to really make a difference in primary care, because the NHS, or the National Health Service in the UK, is in a lot of trouble because, even sort of in these COVID times, a lot of the health issues that people are dealing with are chronic preventable problems. We're talking type 2 diabetes, pre-diabetes, obesity, polycystic ovarian syndrome, hypertension. So all these metabolic diseases, cardiovascular disease. So, I realized that I really had the opportunity to be part of something that could make a huge difference to people's lives, and also maybe in the longer term make a huge difference in terms of protecting our National Health Service, the NHS.
Wow. It's just so cool, man. It's so inspiring that you would choose to, take more of your time and go help other people. The word that keeps coming up in this conversation is hope. And I wonder if you could kind of define that in the way that you think about that word and the way that you would like other people to think about that.
Yeah. So I think the hope that sort of really is powerful is a personal hope that everybody has in the context of their own life, in terms of, okay, right now today, I'm type 2 diabetic, or right now today, I'm obese or pre-diabetic. But what would it mean to me if I didn't have to take the drugs? If I wasn't overweight or obese anymore? What would it mean to me if I could wake up in the morning and feel rested and refreshed and be able to think clearly? What would it mean to me if my wife and my children and my loved ones could see a person that's, getting more out of life and being more present. What would it mean to me if I don't have the fear of certain things hanging over my head, like all of the complications that can come with type 2 diabetes? So I think it's really about what are the positive things that I want for myself in my own life that I don't have now, that I could have if I wasn't obese anymore, that I could have if I wasn't type 2 diabetic anymore, that I could have if I wasn't pre-diabetic anymore. So what would it mean to me if I didn't feel hungry all the time? What would it mean to me if I didn't have to blame myself or feel ashamed? And what would it feel like for me to not feel guilty about having a delicious meal? What would it mean to me if I could eat food that I love, that I absolutely love, that I find delicious, but keeps me full for a long time and is not controlling me, unlike all these ultra processed foods, which are kind of designed to be addictive. So what would it mean to me if I was able to really enjoy my food and really kind of enjoy my food all of the time without any guilt and without any fear of putting on weight and becoming sick?
Wow. Yeah, that's well said. I wonder the lessons that you've learned working with people and providing hope for the rest of us who are also working with people. It could be doctors, nurses, people like me, like trainers or health coaches or registered dietitians. What ways can we help provide those people more hope? What are some really practical tips and tricks for us to be able to show the way and show that there can be hope for these people?
Yeah, so I think personalization is absolutely key, and meeting people where they are. So, for example, some of the patients that I work with, when I talk to them about low carb, what they hear is no carb, and it's not about deprivation. So over and over again, I hear people saying, I can't give up bread, or I can't give up pasta, I can't give up biscuits, or kind of insert, whatever food you want. But that's something that comes up over and over again. And then I think this is where you have to be quite gentle, and you have to really listen and empathize. And sort of one of the things I come back with when I hear that is, it's interesting to me that the way you've said what you've just said, you've said, I can't give up bread. So let's unpack that. So if you were to tell me that I can't levitate, I would believe you, because nobody can levitate. But if you were to tell me that you can't give up bread, let's think about that. What you're actually saying is, I don't want to. And that's fine. So where you are now today, if you don't want to give up bread, that's fine. Let's work with that. Let's start with that initial kind of honesty about where you are now. And if you don't want to give up bread right now today, that's fine. Let's think about reducing the amount initially, and see how you feel. And just as a self-experiment, let's try to find recipes that you really enjoy, where initially, maybe the first week, you're just trying out low carb on 1 or 2 days a week, or one of your 3 meals a day, you're having a low carb meal just to test it out. You're kind of finding recipes that you really enjoy. And let's try to find things that you love to eat that are going to support your health. So I'm never going to tell you to stop eating something that you want to eat. All I'm here for is to show you there is another way, and to show you that you can love food that you eat, and it can support your health. And a kind of an analogy I use with people is everybody and anybody can learn how to drive, but if somebody who doesn't know how to drive gets put in a car and they're given a book to read and say, oh, here's a book, read this book for the next 20 minutes and off you go. You can drive now. That doesn't work. So there's a lot of things in life that we need support and we need to learn. But it might feel difficult at the time that we're learning, but once we've learned it, there's something that can benefit us for the rest of our life. And these lifestyle changes are no different to learning how to drive. You can absolutely do this, but it does take an investment in terms of time. It might feel unnatural at the beginning. There might be some challenges, but that's why we're here in this group, to help each other.
That's very kind, a really interesting and kind way to give people hope and share that hope with others. Another word that keeps coming up is support. And I'm wondering if you were surprised at all by how much the group dynamic really helps build support. It's interesting. It seems like, most people are there in the group to learn from you, but it turns out they end up like almost learning from each other and workshopping things together. Can you comment a little bit about that?
Absolutely. Groups are so powerful, they're so powerful. And I think a lot of people discount the value that you get from being part of a group. And what I've seen over and over again is that the people who invest most in the group and who have the highest engagement tend to get better outcomes overall, because at the end of the day, it's not an intellectual exercise. It's not a case of, here's a set of instructions, here's a list of kind of studies that you can read on PubMed, here's all the science. Because there are so many people, so many people that I've seen. So I used to be a member, I'm still a member of quite a few support groups online. So I've seen so many people who have read every book under the sun, and they know all the studies, they know all the technical information, and they know what to do, but they fail over and over again, and they just can't seem to get that consistency because they think it's an intellectual exercise. And it's heartbreaking to see, because there's so many people who are very, very successful in their professional life, who've got a lot of willpower, who are extremely intelligent and successful, but they don't make progress for two reasons. First of all, they try to do it by themselves, and they look at it as an intellectual exercise and don't really give enough weight to their emotional needs. And secondly, they're perfectionists. They're so successful in their professional life that they're either getting something 100% right, or if they can't get it to 100% right, there's almost that in their mind, there's no point doing it. But that kind of attitude is, I think, quite destructive and poisonous, because, none of us are perfect. Nobody I know who's sustained lifestyle changes is 100%. And the people who are successful are able to forgive themselves the occasional kind of lapse and just move on.
That's fantastic. You're right. Like, to know the facts and to know the studies and things like that, that's good and that's important. It's great. But like we as humans, we need stories. We need to share our stories with others. We're very, we're really based out of the community and need to share that around. You have such a powerful story. And I'm just wondering, the first one or two stories that come to your head about people in the groups. Do you have any people you want to highlight, or any stories you want to share with us from people that you've been able to work with?
Absolutely. So two stories in particular. So a year ago, I met somebody for an initial Zoom-based chat to see if they were interested in doing some lifestyle changes. So a wonderful lady from the north of England, from Yorkshire. And so I think she had been type 2 diabetic for about 8 years, and also, carrying a lot of excess weight as well. And so she joined my group about a year ago, and just the transformation that I've seen in the past year, because she got confirmation of a normal HbA1c before Christmas. So before Christmas 2020, she got confirmation of a normal HbA1c. Reconfirmation in, I think, March 2021. And yeah, the doctor has said, you're in remission. You don't need to take blood pressure medications. You don't need to take metformin. You don't need to take the statin drug you were on. And just the transformation in just her outlook on life in terms of, she's recently retired and, really enjoying life, doing yoga. Right now she's in Dubai visiting a friend. And just the level of energy she has, because she said to me a few weeks ago that she'd spent a day out with some of her friends, and she looked at her kind of step counter at the end of the day, and she'd clocked up something like maybe 12, 13,000 steps that day. Wow. And she hadn't even noticed it.
Wow. Yeah.
So that's one person. So drug-free type 2 diabetes remission, we used to be obese, no longer obese, and, really kind of having a great time, getting so much out of life. So that's one person. Then another person who joined my group relatively recently, probably about maybe 5-6 months ago. Now, not all of this weight has been lost while she was in my group, but in total, she has dropped 133 pounds in weight.
Wow.
133 pounds in weight. And she's also in type 2 diabetes remission. And she's thriving, visibly thriving. It's amazing to see. Because the other day, she does quite a stressful professional job, and she was having a hard week. Normally, she'd be 1 or 2 meals a day, very low carb, keto level kind of carb. And when she was stressed, without even sort of having to check with me or any of the group, she automatically did something pretty amazing, which was she kind of gave herself the grace to say, I'm under stress. It's not optimal, but I'm going to have some keto snacks, some foods that I really enjoy, cheese, charcuterie, olives, those kind of things. And, normally she'd be really strict within her eating window. So she went from OMAD to maybe 2 meals a day with some snacks. And at our next session, when I heard this, I said to her, this is amazing, because, you've recognized that you're under stress, you've given yourself some grace, but you've still eaten foods that support your health. You haven't jeopardized all of the progress that you've made by, going headfirst into kind of ultra-processed foods and, sort of sugary foods and kind of Chinese takeaways and all these kinds of things. So whereas that used to be what happened in the past with her. So just hearing that she's come so far in terms of her development that she's automatically doing the best thing possible in the given circumstance. I mean, that to me is amazing.
Wow, those are really powerful stories, super inspirational. Congratulations to both those people. That's really wonderful and such a great example. And you're right, that is a classic kind of a setup where people normally backslide. They get in a stressful situation, they eat something they know they shouldn't, and then that starts the cascade that sends them down the wrong path again. And so for her to recognize that and resort herself out is amazing. That's wonderful.
Yeah.
Where do you see these going in the future? The groups that you're working with?
So hopefully, when we finish the initial pilot in September, hopefully we'll kind of, once we publish the results, ideally in a kind of scientific journal or a medical journal, hopefully the pilot will become an official kind of NHS rollout, in which case we can scale it up. We can get many, many more health coaches trained up, and we can really start to make a difference in primary care in terms of type 2 diabetes remission, and also pre-diabetes, obesity, polycystic ovarian syndrome, all of those kind of lifestyle-related chronic preventable conditions. And because this is so doable, we can do this. We can absolutely do this. We can do this at scale and at pace and make a huge difference to the NHS. And it's not about saying that, low carb and intermittent fasting and these lifestyle changes, it's not about saying that it's the only way. It's about having it as a standard option that's available to patients who choose it, because ultimately all of the patients who join these programs are self-selecting.
Yeah, I agree. Just having it as an option, not forced on people, but just something they could try. How do people support this? This is such a cool movement. Like, what is the best thing that somebody could do to support you guys?
So the Public Health Collaboration, as I mentioned, is a UK charity. So that is phcuk.org, I believe. Let me just double check that. Yeah, so that's phcuk.org. So that's a non-profit, so it's a charity. So you can donate to the charity to support kind of this kind of work, or there are so many resources available for free at this website, phcuk.org, and also available on the Public Health Collaboration YouTube channel that you can just share. So if anybody listening is suffering from type 2 diabetes themselves, or pre-diabetes or obesity, or knows somebody who is suffering from one of those things, there are so many powerful resources available for free, both on the website and on the YouTube channel. And if anybody wanted to support, yes, they can donate, but anybody sort of based in the UK especially, the most valuable thing somebody could do is actually give up some of their time and become a volunteer, and hopefully an ambassador for the PHC like myself, because our time and our energy, they're the most valuable things that we have.
Great answer. That's awesome. I encourage the listener to contribute and help out in any way possible, even if you're just sharing around some of those free resources that can make a huge difference. And if it makes a difference in one person's life, like seriously, all of it is totally worth it. Eranda, what is one simple tip you would like to leave the listener from this conversation today?
Right. So one simple tip I would say, so it's all about habit change. It's all about habit change. So what do I mean by that? So I'm kind of going to borrow and kind of start channeling James Clear, the author of the Atomic Habits book. So people really discount how powerful habits are for both good things, positive things, and negative things. So what's really surprising is establishing a good habit that's going to help you in your life for the rest of your life is surprisingly easy if you know how. And by the same token, if you have a destructive habit, a bad habit, it's surprisingly easy to break that habit. So I'd say the key to forming a good habit, that could be going for a daily walk. The key to it isn't some superhuman effort in terms of, okay, starting tomorrow, I'm going to walk 5 miles every day, and that's completely unrealistic. So if there's somebody right now today who is obese and not used to being active, where they could start is really committing to maybe just a 5-minute walk in the morning, but being consistent with that and sticking with that habit for a few weeks or a few months until it just becomes second nature. As in, I wake up, I'm a person that walks every day, because that's not really based on a goal. It's not really based on a short-term goal. It's based on the recognition that it's a healthful habit that's going to serve you for the rest of your life. And before you know it, your 5-minute walk that you've been consistently doing for a few months, you've ended up doing, 2-3 different walks every day instead of just the one walk. And your energy level goes up, and you've put on a bit of lean body mass, and there's the mental health benefits of a habit like that as well. So the key to forming a healthful habit isn't necessarily, going to the gym for 2 hours and maybe doing a couple of workouts like that, getting into some real pain and maybe even injuring yourself and then never going to the gym again. It's about starting small. So, and the flip side of that, if you're trying to break a destructive habit, now, for my own personal life, it's something like snacking on ultra-processed foods. So especially if you live in a mixed household, it can be quite challenging because other people in the house may not be living the same lifestyle or trying to make the same lifestyle changes that you're trying to make. So in that case, it could be introducing a small amount of friction. And it's surprising how little friction you need to introduce to stop a bad habit. So say if you live in a household that has got junk food lying around, so crisps and chocolates and candy bars, things like that. So you could have a conversation with your householders to say, look, I'm really trying to make a difference in my health. Would it be okay if I put all of these in a cupboard that I don't go to? So all of that food is in a single cupboard. If you want to have it, you can have it. But because there's nothing else in that cupboard that I want, I'm never going to open that cupboard. So because I won't see it, I won't be tempted to eat it. And approach the right way, people are receptive. And again, if you've got things in the house that aren't ideal, the best thing is to not have them at all. But you could put them at the back of a cupboard and put something heavy in front of it so that you actually have to take things out before you can access those things. And just that tiny amount of friction, it's surprising how quickly you can break a bad habit. So I'd say if there's any one thing that people can take away is to start small with good habits, and with bad habits, introduce a bit of friction, and you will have lapses, and forgive yourself. And what do I mean by that is if you're able to forgive yourself that lapse, it means that you can get right back on the horse straight away, as opposed to thinking, okay, I've blown it, and then having a binge for 2 weeks.
Yeah, that is amazing advice. I think anybody could benefit from that. I want to read you something before we go. When I reached out before the show and just asked if there was something special you really wanted to make sure we covered, and you wrote me back, and I just want to read a portion of that. For any listeners suffering from type 2 diabetes, prediabetes, or obesity, be open to the possibility that it's possible to recover and live a happier, healthier life of abundance through simple lifestyle factors that are sustainable. It starts with hope. All good things follow. That is just a beautiful and wonderful statement. I really wanted to share it with everybody before we ask you, where can people go to find you and find your work?
So I'm on Twitter. So that's Eranda W1. That's my handle on Twitter. Same handle on Instagram. I'm also on Facebook. So I've been quite prolific on Twitter, sort of since I changed lifestyle. So so there's the PhDuk.org website as well. So that's an amazing resource. So that's where people can find me. And
That's tremendous. We will link to all of that in the show notes. Thank you so very much, Eranda Wickramasinghe. I think I kind of closely did it twice accurately.
Oh, that's perfect. That's perfect, Casey. Yeah.
I just, it's been a hard year and a half, and it's been dark in certain ways, and there's times when I feel like things are a little bit hopeless and a little dark, and I don't know what good can come from the world, and people like you just inspire me to no end. You're out there with your positive message of hope, sharing it with people for no pay, just for the joy of actually doing it, because you have more energy now because you changed your life. And I'm so grateful for you and for your work and all the lives that you are changing, and we're so grateful for the time that you took to be on our show today. So thank you so very much. It was an absolute honor.
Thanks, Casey, and likewise, absolutely honored to be on your show.
That's fantastic. And this has been another episode of Boundless Body Radio.